Hello and welcome to Speaking Week and today's session specifically for nurses. And we're streaming live to both OET official Facebook and YouTube channels. So hello to everybody joining us live on one of those channels. And we love hosting Speaking Week and particularly hosting dedicated sessions for each of the 12 OET professions. So if today's session doesn't match your profession, don't worry, check out the dates on the screen now for the other professions that we've got coming up tomorrow and on Friday. If you've missed your session, they're now available as videos from our YouTube and Facebook pages, and you can watch them again at any time. If you are a nurse, particular welcome to you today. If you're not able to stay with us for the whole session, those videos that will be available once the session finishes will be great for you to catch up on anything that you missed. So in this session, we're going to look at a brand new OET role card for nursing, and we'll listen to some actual candidates completing the role play as they prepare and practice for their speaking test. It's also going to get quite interactive. I'm going to regularly ask you to share your opinions and comments as we go along. So please make use of the chat box on your social media channel for this. And there should also be a few minutes at the end of the session to answer any questions you have about today's session. My colleague Lauren is also on hand behind the scenes, checking comments coming through and can assist with other queries as well. So let's practice this now. I want you to tell me in the chat how many role plays you complete in your speaking test. And this is a really easy question. I'm going to give you a multiple choice option to choose from. Do you complete 1 or 2 role plays in the OET speaking test? Let me know in the chat whether it's 1 or 2 role plays. That's great. I can see some correct answers coming through already from Gudu, from Tatiana, from Mojtaba, from Shanila, Sonia, Casita. That's great. All of you have the answer absolutely correct. You do 2 role plays in your OET speaking test. So now I know you're all warmed up and ready. Let's get started on today's Speaking Week session. So on the screen now is a new role card for nursing, and we're popping into the chat box now a link to the role card. So if it is a little bit small for you to see on the screen, look out for the link in the chat. It starts bit.ly, and you can download that card so that you've got your own copy. We will be adding cards from the sessions for all of the OET professions to the website at the start of next week, once we've done all of the live sessions this week. But for now, I'm going to show you and work with you on the candidate card, which is, of course, all you get to see when taking your test. The interlocutor card stays hidden to make the conversation much more authentic and unscripted. And before both role plays in your test, you are given 3 minutes to prepare. So I'd like you to tell me in the chat up to 3 things that you personally do when you are getting ready to do a role play. This could just be for practice purposes, or perhaps if you've tried taking OET already, what do you do to make the best use of the 3 minutes that you get before each of the role cards during your preparation time? And there's lots of different things that you could be doing, plenty of correct answers and good ideas. So let me know your personal tips, perhaps, for what you think is a good way to spend your preparation time. So Ritika is suggesting you need to know the patient and think about how you're going to do your introduction. Both very good ideas. Thanks for those. Malinga is also agreeing with that. She's saying think about the introduction. That's a great idea. Chinshu is saying, think about the setting and whether you know the patient or not. Yep, I like that. Panjara is saying, assess the situation, where the place where it's happening, think about how to address the patient. Kasita underlining important words, absolutely. Gadu making sure you understand the tasks clearly. Saeed suggesting to make some notes. Yes, I think that's a really good idea as well. So really, really good ideas coming through on chat. Thank you for sharing those. And the advice really is, whatever you do, make sure you are methodical and use your time wisely. And I'm going to talk through this card as an example of what is good practice when you're using that preparation time. So first of all, as some of you have mentioned, it's really important that you look at the setting at the top of the card. This is obviously a really small piece of information, but it is still quite significant because it tells you how serious or routine the situation is, whether the patient is currently at home, visiting you at your place of work, or is admitted to hospital. It can also even tell you something about the patient's age. So, for example, if the setting is a children's ward or an aged care home, you already get some ideas about how old your patient is. And there's a really wide range of settings that can be used in the nursing test. And of course, you don't need to say anything about the setting in the role play, but just understanding where the situation of the role play is taking place can help you start to visualize the kinds of conversation that you are about to have. In this card, the setting is clinic, which tells us not very much, but it tells us that the patient has come to visit you in your place of work, and the conversation is likely to be about a routine health situation. The second thing to check is the background information, and this will always give you details about the patient's age and the healthcare reason for the conversation. But official OET role cards will never tell you the patient's gender or a patient's name. And there's an important reason for this. All OET tasks are written to be genderless, so that on the day of your test, your patient's gender becomes that of your interlocutor. If you have a male interlocutor, your patient is considered male. If you have a female interlocutor, your patient is considered female, and so on. The background information also tells you if you are speaking to the patient themselves or a relative of the patient. And if it is a relative of the patient, so for example, the parent of a young child, the background information will also make it really clear that the child is not present for the conversation. It will say that in that background information, so that it's very clear for you that you know you're just having the conversation with the interlocutor. You don't need to pretend that there's someone else in the room with you. For this card, the background information tells us that you are speaking to a 51-year-old patient who has come to you to have the stitches on their hand removed. Nothing in the context suggests you've met this patient before, so starting with introductions here would be appropriate. And further details about why the stitches were needed are also given in this background information and the patient's Sun history. And finally, of course, you need to spend time thinking about the tasks that are given in a bullet point list. And the purpose of these tasks being given to you is so that you have plenty to speak about during the 5 minutes of your role play. And it helps you understand whether you are giving or gathering information, providing advice or reassurance, or perhaps telling the patient some good news or bad news. All of these things are covered in those tasks. The brackets on the task card as well are there to help you sometimes give you examples of things that you could mention or directions about how to complete the task. The other thing to obviously focus on are the verbs, which tells you the function of the communication, as I mentioned, whether you're giving information or gathering information. On this card, the tasks show a balance of gathering information by asking questions about the patient's concerns, their sun habits, and their sun safety and wound, but also to give straightforward information, the diagnosis, the need to monitor their skin, and to encourage the patient to continue to be compliant with sun safety recommendations and to proceed with having the stitches removed today. For each task, as I mentioned, there are some ideas given for you in brackets. But remember, there is an expectation that you don't read out that information given in brackets simply as a list. You do need to expand those ideas into full thoughts and use your own words to add more detail to personalize that to the patient's particular situation. A couple of final things to remember during your preparation time. I think these are a few really good things to ask yourself each time. The first one is, are there any words on the card that you would like defined or pronounced? And on this card, I think in particular, you might like to hear the pronunciation of squamous, as well as the word lesion. Because lesion can be quite a difficult word for some candidates to pronounce. So hearing the interlocutor say it for them during the preparation time can be helpful. The rest of the words on the card in terms of definition, I think the meaning should be pretty clear. They're fairly standard for nurses. But if there is anything that you don't feel comfortable with, it's always best to check during the preparation time. Another thing to ask yourself is to consider whether there are any words on the card that the patient would be unfamiliar with, given the context of the conversation. So, for example, if the patient is receiving a new diagnosis, you wouldn't expect them to be familiar with the medical terms associated with the condition. You would then need to spend some time during your preparation time thinking about how you're going to introduce those medical terms, or whether you want to just omit them in favor of something more appropriately lay in terms. On this card, I think, and at this stage of the patient's treatment, they're likely to be familiar with all the words on the card. So there isn't perhaps anything you particularly need to consider swapping or omitting. And the last thing I always recommend to candidates is just to spend a few seconds thinking about timing. There aren't any marks added for completing all of the tasks on the roll card, but you are expected to manage the conversation as you would in real life. And that means starting the conversation, but also moving on from topic to topic once you feel it's been sufficiently explored by you and the patient. So it can be helpful just to assign each task a rough time to complete, how long you think it will take to complete, so you know which tasks to move through more quickly and which tasks you want to give yourself a little bit longer to talk through. There are a number of reasons why some tasks might take a little bit longer to complete than others. For example, you're giving the patient some new information that you think the patient is likely to have questions or concerns about the information that you're giving, or perhaps the information is going to be sensitive. These are all reasons why something might take longer. And on this card, I think two tasks really stand out to me as needing a little bit more time. And this is task 2, when you are explaining the diagnosis and giving the patient some reassurance about the effectiveness of the treatment. And task 5, when you need to emphasize things to the patient, because that word emphasize often means that you're needing to persuade the patient. It might not be something that they particularly agree with. On the other hand, the other tasks 1, 3, and 4 look quite straightforward. So I would have in mind moving through those quite quickly so that I have more time to spend on task 2 and 5. Now, we recorded several role plays with candidates ahead of Speaking Week, so we could use the audio to discuss in these sessions what are some things that you should do and avoid in your speaking test. And the first recording we're going to listen to is with Annie, who was in Canada. And I want you to listen to the start of the role play as Annie does it. And you can still see the background information on the screen. And so I want you to listen to the introduction and then tell me in the chat, compared to that role card, do you think this opening, this introduction is appropriate or inappropriate? All right, so listen and then tell me if you think it's appropriate or inappropriate.
Okay. Shikana. Hi, good morning, Mrs. Shikana. Very nice to see you today. Can you please tell me, well, my name is Annie. I'm your doctor here today. Can you please tell me that what you hear today?
All right, it was quite quick, but what did you think to Annie's introduction? Do you think that was appropriate for the situation or inappropriate? Let me know in chat what you think. Tawanda is saying inappropriate. And we've got a few people agreeing with you. So Yirong, Chelsea, SD, Tatiana, Mariam all saying inappropriate. B is saying it was quite non-formal. And I think I would agree with you. Let's have a look at the script of that introduction. And you can see that the language is quite polite, but it's also a little bit jumbled and confusing, especially when the nurse introduces herself as a doctor. And remember that a task that starts with the verb confirm can be completed with a statement instead of a question. So instead of saying, what brought you here today? The nurse could have said something like, I understand you're here to have your stitches removed today. Is that right? So my tip for this part is starting the conversation is obviously a really small part of your speaking test, but it can determine how the rest of the role play goes and also how confident you feel about how you're doing in the speaking test. So I think it's a really good idea during the preparation time to write down the language you want to use to start the role play to make sure that you can start confidently and clearly. All right, now we're going to listen to 2 more short extracts of Annie speaking, and this time I want you to think about her fluency. So from extract 1 or extract 2, which one would you say is more fluent? So let me know after listening to the 2 audios if you think it was extract 1 or you think it was extract 2 that was more fluent.
Actually, no, I don't know what squamous cell carcinoma is. I feel like it is cancer, so I'm a little worried actually.
Okay, well, you're correct. Is one of the skin cancers. What can cause this is that when people exposed to the sun for the extensive amount of time, they may have higher chance to have this cancer. So I can see that you're here for remove the lesion. So how so you had this surgery. When did you have this surgery?
Is it serious?
Well, I would not say it is very serious. but I can see that your surgery area is healing really well. Usually, the surgery result is pretty good. It's unlikely to spread any part of your body, but it
Okay.
is very important to monitor your skin condition.
Right. Okay.
All right, so we heard 2 recordings there from Annie. Which one did you think was more fluent? Was it the first one or the second one? Or you're not sure? It was perhaps a little bit difficult to hear from the 2 extracts exactly where one finished and the second one started. Yes, we've got sort of 50-50 coming through at the moment. Some of you think the first one and some of you the second one, which is fair enough. Let's have a look at the script of Annie speaking, and that might help clarify things a little bit more. So here you can see the script of the 2 different extracts. They both have a few problems with fluency, but extract 2 is actually slightly more fluent and slightly more even speech. There are still some examples of hesitation, but they're shorter in extract 2 and a typical feature of natural spoken English. Although the start of extract 1 was quite good, there are quite a few pauses that then come through into what Annie is saying. You can see we've got a 2-second pause, then a 3-second pause. And this suggests that she's struggling to know exactly what to say. So my tip for hesitation is that pauses and hesitation are a natural part of unrehearsed speaking, like you're doing in your role play, but too many of these pauses or hesitation sounds can suggest weakness in your ability. So my recommendation would be listen to a recording of yourself completing a role play and try and count how many hesitation sounds you make in any one response, a bit like the 2 individual extracts you can see on the screen. How many hesitation sounds like or even pauses are you making? If you find on listening to yourself that you're using a large number or repetitive sounds, then this could be something for you to practice and work on. So let's listen to one final extract from Annie, completing the tasks around the patient's sun habits and need for ongoing prevention. And this time I want you to put yourself in the patient's shoes and tell me, after listening to the nurse, how would you feel? Would you feel A, annoyed, B, reassured, or C, anxious? So listen to the nurse and then tell me in the chat if you think it's A, B, or C.
Yeah, so I always wear my sunscreen, SPF 30 or higher sometimes, depending on the time of the year. And I'm always wearing a hat in the sun, but maybe it's just too late, because I obviously spent a lot of time in the sun during my teenage years, so I feel like it's the damage has already been done.
Yeah, well, I believe that you're doing a great job. You're wearing sunscreens and you're wearing hats. That's excellent. In a situation that if it's really hot, maybe you can get like a shirt, cover your arms and body, especially when you go on the beach. How does that sound? Can you do that?
Yeah, I think I'll look after my skin from now on, and do as you say.
All right, so what did you think? How would you feel as the patient, which was the first and the last voices you heard? The nurse was the voice in the middle. Do you think you would feel A, annoyed, B, reassured, or C, anxious? We've got mostly Bs coming through, mostly reassured, a couple of Cs, a few anxious ones as well. So let's have a look at the script of what the nurse said. So I agree. I think you're likely to feel reassured by the positive language the nurse is using during their speech. And you can see on the screen here, she says, "You're doing a great job. That's excellent." And plus, there's some tactful suggestion language. Maybe you can, and can you do that? And in addition to that, the nurse's tone of voice is positive to match the encouragement she is giving the patient, which should further reinforce the reassurance the message is giving. So as a tip, I would say patients obviously enjoy hearing good news and that they are doing something well. So use positive language and tone of voice at appropriate moments in your conversation to help them feel good. If there's any bad news or negative content which needs to come in later in the role play, it can also make your patient more receptive to this if they've already heard some positive news, encouragement and reassurance from you near the beginning. So overall, this was a good effort from Annie with evidence of active listening and asking open questions. But overall, there were some issues with fluency and she needed to show more understanding of the role card in a couple of places. These were bits that we didn't hear today, but with some more practice, Annie would then be ready to book her speaking test. Let's listen to some examples from another nurse now, this time Imelda from Bahrain. And in this first extract, which is a bit longer, the nurse has been asked about squamous cell carcinoma by the patient. I want you to listen to their interaction and then tell me in the chat, would you do anything differently? Is there anything you would alter, or would you do it exactly the same if you were the nurse in this test?
Yeah, I had the doctor said I had something called squamous cell carcinoma, and isn't that just another name for skin cancer? Yeah.
Yes, that is correct, Miss Ashkana. But for now, I understand your visit now. It's to remove the stitches, and I'm here to do the procedure. So let me just undergo the procedure, and then during the procedure, I will tell you more about it. But before that, I'm sure the doctor already explained to you about your condition and before your procedure.
Actually, no, I don't know much about it. Like I said, I just think it's another name for cancer, and I'm actually quite worried.
Okay, don't worry about it. Anyway, you already undergo the procedure for the removal, and that is the most important for you right now. So before I begin my procedure to remove the stitches, I will clean the wound, and then I will put a new dressing. Do you have any concern that you want me to know?
Yeah. Will there be more lesions like this in the future, and will I have to have surgery again?
Okay. I believe I understand that you're still concerned about your condition. So, Miss Kaina, so this squamous cell carcinoma, you are right, this is the type of skin cancer. So it is caused by the sun exposure, or we can call it ultraviolet radiation. And just don't worry, because this surgery, before you do this surgery, I believe the doctor also already reassure you about the effectiveness of the surgery. It means the removal of your lesion. So let me reassure you again, this cancer or this lesion is unlikely to spread. Okay, and yeah, so
All right.
but
All right, I can already see coming through chat, you've picked up exactly what I was hoping you would while listening to the nurse there. People, Annie Beth, for example, not giving the information, Chelsea not answering the patient's questions, B, she should have added some reassurance, 10 will respond differently, like helping the patient with her initial concern. Mariam, she's brushing off the patient's concerns. Yeah, absolutely, all good suggestions. So let's look at what the patient said in the script. So sadly, this is not a good example of picking up the patient's concerns or responding to them appropriately. Each time the patient's concerns are not taken up, and instead the nurse tries to push on to talking about removing the stitches. It's only the third time the patient mentions some concern that the nurse realizes she needs to address the concerns and offers some reassurance. But even this response is quite businesslike and would have been improved with some empathy. If the nurse had started by answering the patient's concerns as soon as the patient mentioned them, they could have been dealt with more quickly and the rest of the role play got on with. So I think you all really picked that up very well in the comments. So my tip here is make sure you give your patient your full attention and don't ignore what they say because you think your information is more important use of time. After the patient asks you a question or says something, make sure you pick up what they have said, show some empathy, or perhaps ask a further question to clarify your understanding and demonstrate you have been listening. Thinking about the nurse's tone in this next extract, I want you to tell me which adjective you think best describes the nurse's tone when listening to her. Do you think it's A, friendly, B, nervous, or C, firm? Which one of those adjectives do you think?
yes, but I want you to understand and I want you to take note that apart from the procedure, you have to monitor or you have to check the skin if there is a new changing of spots. And of course, you have to go for your regular doctor checkups as well.
Okay. Okay. Sure. I think I can do that. Yeah.
Very good. Again, I can see some good answers coming through on the chat. You think that the nurse sounds firm. And there are certainly times when a firm tone of voice is needed when talking to patients. So, for example, if a patient persistently refuses to listen to some advice or suggests that a recommended course of treatment isn't something that they want to comply with, then you might need a firm tone of voice. But in other situations, it's probably not going to be the appropriate tone to use. The nurse here is really emphasizing to the patient that they need to monitor the skin and have regular checkups. But we've just heard how anxious the patient is. And so the tone, voice, and choice of words here is likely to make the patient feel anxious again rather than reassured or comforted. So think about the tone that you use and what tone of voice is most likely to get your patient to follow your advice or recommendations. This final extract from Imelda, the nurse is discussing future prevention of skin lesions. And I want you to tell me on a scale of 1 to 3, 1 being weak, 2 being okay, 3 being strong, how would you rate their use of language features here? So remember, there are linguistic criteria that you are assessed on, as well as clinical communication criteria. The linguistic criteria cover intelligibility, fluency, appropriateness, and grammar. So thinking of all of those things, how would you rate them out of 3 for this piece of speaking?
Yeah, when I was younger, I spent a lot of time in the sun in my teens. So yeah, I do, take precautions, like I wear a hat in the sun and I put sunscreen, but I just feel like it might be too late now to do all of those things.
Yeah, but it's still important that you apply sunscreen, and it is still important that you apply shields on your, for example, yes, you are using the hats, or you will use a long sleeve when you be under the sun.
Okay.
Yes, and I would like to stress also the need to do this, to continue this prevention.
Right.
All right. Oops. Sorry, I realize that perhaps I need to be a bit clearer about when the patient is starting the recording, but now the second voice was the nurse, and I think we're getting responses coming through of 2 or 3 mostly. And that's certainly what I would have said as well. I think this is somewhere between a 2 and a 3. You can tell that the nurse is very comfortable speaking in English. She's clear to understand, and there's good fluency and grammar. But the appropriateness of her tone and the lack of empathy for the patient are weaknesses that undo some of those strengths that she has in fluency and language. So my tip is that it's important that you focus on all the assessment criteria that you will be scored on by the assessor, and understand how to demonstrate them in the role plays. And at the end of the session, we're going to share a link to download those speaking criteria. So stay tuned to receive that link at the end of the session. So overall, Imelda is not quite test ready at the moment. She needs to work on making the conversation more patient-centered and really listening to what the patient is saying or asking, so that she can respond appropriately and in a way that would reassure or encourage compliance, depending on the tasks. With the language strengths she already has, making those improvements would mean she could be quickly ready for the test. The third nurse that we're going to listen to is Boonchai from Australia. And in the first extract, I want you to let me know, what is he doing? What is the nurse doing in this extract? And you've got 3 options to choose from. Is he picking up the patient's cues? Is he signposting? Or is he demonstrating a respectful attitude? So have a listen. Boonchai is a male voice and the patient has a female voice.
Yeah, you are right. It's a skin cancer, but you don't have to worry too much about that. The reason is that that skin cancer has already been removed. So we just need to do a little bit of cleanup and remove the stitch. And today I'm going to do that. Is that all right for me to do so?
All right, that was quite quick. Which of those things do you think Boonchai was doing? Picking up the patient's cues, signposting, or demonstrating a respectful attitude? We've got quite a few C's coming through and some B's, 1 A as well. Yeah, lots of C's showing a respectful attitude. Very good. In fact, this was a little bit of a trick question, because in this extract, the nurse was doing all of those things in the one response. So he begins by picking up the patient's cue of concern that they have a type of skin cancer. They could have done this a little bit better, but they have at least acknowledged the concern. Then he provides a signpost about the direction of the consultation to clean the wound and remove the stitches, before respectfully checking the patient is happy with this. So my tip here is a little bit similar to the last one, but don't treat the assessment criteria as individual items that you can attempt to tick off one by one. Successful communication will cover a number of descriptors in the same piece of speech, so you can cover more than one thing at any one time. Next, listen to the nurse responding to 3 questions from the patient, and I want you to tell me which of their responses is most successful. So remember, the patient is female, the nurse is male. Listen to them and then tell me which of the nurse's responses was most successful, 1, 2, or 3.
Okay, all right. So you mentioned that I should be careful in the sun.
Yes, and after this, we remove the stitch and we clean your wound from the surgery. You just need to have a little bit good protection and try to keep it clean and dry until we see you next time.
Okay. What should I do regarding the sun? I mean, I always wear sunscreen.
Yes.
Is that
Yes.
enough? I feel like I was in the sun so much when I was younger. Maybe it's too late now for me to protect myself.
I'm great that you asked these questions. It's certainly that even you have protected yourself when you was young, but when you have grown up, that doesn't mean that you will be out of the risk of getting the cancer cells in your skin again. So the best is that you have to keep yourself protected from the sun when you go out with a very strong sun, and make sure that you have the sunscreen 45 plus at least, in order to make sure that you're not exposed to any UV which can cause the cancer.
Okay, I'll take care of that from now on.
All right, so let me know in the chat, do you think their first, their second, or their third response was most successful? We've got 1, 3 coming through so far from Tatiana. Mariam agrees, also a 3. Gudu and Netta are suggesting the second response was most successful. All right, well, let's have a look at the script. And I think that will help us to clarify this. So it's really the third response that is most successful. In this response, the nurse acknowledges the questions the patient is asking and provides a response which is linked to that question. We can see that the patient's first response is completely ignored, apart from a quick yes, as the nurse moves on to a different topic. And the second question also is only answered with yes. So as a tip, you should be prepared for your patients to ask you questions. And sometimes you can actually predict what some of those questions are going to be during the preparation time, because when you're reading the task and thinking about what you're going to say, it'll be easy to imagine what follow-up questions the patient might have for this information. Unless the patient has asked you a question that only requires yes or no, make sure you provide a longer response to demonstrate you have been properly listening and that their questions are important to you. In this final extract with Bunchai, the nurse is completing the first part of task 5, which is to emphasize reasons for removal of the stitches now. And I want you to listen out for him saying, I understand your concern, and then tell me in the chat what alternative language he could have used there instead of "I understand your concern"?
I do feel like maybe it's a bit too early to take the stitches out.
Oh, I see. I can understand your concern, but I think that it is important when the wound is getting dry. The best way to improve the healing process is that we need to remove these stitches. So, and this stitches is not going to be very painful. Do you have any other concern apart from this?
All right, so hopefully you heard him say, "I understand your concern." What else could have been said as an alternative there? Linta is suggesting, "I certainly understand your situation." 10 is saying, "May I know why you think that?" Yemisi is saying, "I understand how you're feeling right now." B, "I understand you might be worried." Jobin, "Thank you for telling me how you have been feeling." Remia, "That is a reasonable concern." Well, actually, I think 10 had the best suggestion, asking why the patient thinks that. Exploring why the patient feels it was too early to take out the stitches. So, for example, saying, "Can you tell me why you think it's too early?" Would have been a really good option here. "I understand your concern" is a favorite of OET candidates, but it's not one that the assessors really like because it's quite vague. There are always some other alternatives, like you were suggesting. "I understand you feel worried about my suggestion," or "That's a typical concern for many patients." But here, really asking why would have been a better way to demonstrate that you have understood, and then you're trying to incorporate the patient's perspective into your response. And that means that you are also making your explanations more personalized to the client's set of individual circumstances. So overall, I think Bunchai is in a good position to book his speaking test, perhaps in a couple of months. His speech is clear and easy to understand, just a little bit of hesitation, and he is quite patient-centered. So working on those identified weaknesses of more closely responding to what the patient actually says will help bring him to a test-ready standard. So the last nurse we're going to listen to in detail is Jane Pearl from the Philippines. Let's start by listening to her opening of the role play conversation. And like you did before, tell me if you think this is an appropriate or an inappropriate way to start this role card.
Good morning, Alex. My name is Jane Pearl, your nurse for today. How are you?
Hi, Jane Pearl. Yeah, not too bad, thanks.
Do you have what brings you along here today, anyway?
I just recently had a lesion removed from my hand, and the doctor told me to come in and get the stitches out today.
Okay, so you came here for the removal of stitches, and then when we get your removal, we will clean your wounds, and after that, we're going to redress it. So, do you have any concerns before we do these things?
There we go. So do you think that was an appropriate or inappropriate way to start that role play? 10 is saying appropriate, and Annie Beth Gadu also saying appropriate. Tatiana thinks inappropriate. Chelsea agrees inappropriate, but more people are coming through saying this is appropriate. And I would agree. I think there's always things that can be improved on, but overall, this was quite appropriate for starting this role card. Perhaps the improvements would have been if the nurse had summarized the reason for the conversation without that second question. So that summary that she gave at the end was quite good. But the second question was a little bit jumbled and ended with an inappropriate anyway. So some good things and some not so good things, but overall this was quite appropriate. A tip here, if you do make a mistake, even this early on in the conversation, don't let it throw you off balance. The assessors are scoring you from the speaking they hear on both role plays. So as long as you are overall providing strong examples of the assessment criteria, little stumbles like this one won't impact your final score. Now listen to Jane Pearl finding out some more information about the patient. This took place a little bit later in the conversation. And I want you to let me know if you think the questions she asks here are clear for the patient or not. So have a listen and then tell me yes, 1, 2, no, or 3, not sure.
So how about, so do you have any plans for surgery in the future?
Well, hopefully not. I don't know, is there some way that I could protect myself from the sun, from more damage?
Okay. So can I ask you, what are the habits do you do during when you're exposed to the sun?
Apologies, the recording quality there wasn't so good in that little extract. But what did you think of the 2 questions the nurse asked in that extract? Were they clear? In which case answer 1, which is yes. Not clear, in which case answer 2, no. Or 3, you're not sure. There are quite a few 3s coming through, which might have been the recording quality, but also a few 2s. You don't think these are very clear. And I think I'd agree with you. These questions aren't particularly clear. I would say not clear this time. The nurse seems to have got confused about the task she is trying to complete, or perhaps she thinks the patient has suggested they're thinking about having more surgery, or perhaps she's just misunderstood the patient. She does recover the conversation to move on to asking the patient about their sun habits, but the question still isn't phrased very grammatically accurately. So my tip here is it's a normal part of speech to require clarification now and again. Everybody does this, regardless of whether this is your first or second language. So during the speaking test, if you feel you haven't understood the patient, it's perfectly fine and actually encouraged to ask them to clarify, as you would do with a real patient in real life. So saying to the patient here, for example, I'm sorry, are you saying you're thinking about having surgery? And then the patient could have clarified that actually she was asking if she would need more surgery, and that would have cleared up this misunderstanding. Listen to this last extract where the nurse and the patient are discussing the stitches coming out. And I want you to listen for one word or phrase that the nurse is overusing in this response, and then let me know in the chat what that word or phrase that she overuses is.
No, it's been good actually. There's no pain. It's fine. I do think it's a bit early to have the stitches removed though, don't you think?
Typically, we need to remove that after 7 to 14 days. And then we need to remove the stitches now so that we can find if the wound have a good healing, and then the doctor can assess it. And we need to keep the wound clean, covered, dry, and we need to consent you if we need to remove the stitches.
All right, let's see if anyone was able to pick that up. What word or phrase was the nurse overusing there? Yes, Tatiana. Need to. Namakuma, yes. Gracie, yes. Mariam, yes. Everybody who said need to, you're absolutely correct. Let's have a look at it. Count up, in fact, how many times the nurse says need to in this one piece of speech. So she actually says need to 4 times in a response that lasts 20 seconds. And look, it's not inappropriate for the situation. It does demonstrate a very limited range of language. If the nurse had separated the pieces of information into smaller chunks, so for example, the time frame to remove the stitches, then the benefits of removing now, then caring for the wound post removal, and then consent, rather than adding them all in one list, she could have more easily inserted some other language or checked with the patient how they felt about those different things. So as an example, she might have said, typically we need to remove the stitches after 10 to 14 days, which is now. Once that's done, we can check that the healing is going well. It's important to keep the wound clean, cover and dry it. You know, so there are definite ways that she could have avoided using need to so often. The tip is really avoid running lots of ideas together in one piece of speech, which can be confusing for the patient to try to follow and prevents them from asking for clarification if they need it as you are speaking. Overall, this was a good attempt for Jane Pearl. She actually was doing this recording as her first ever try at a role play card. And she started really strongly and speaks clearly and warmly. But as the role play continued, either she got a little bit nervous or because she wasn't really familiar with the format of the role play, she started to perhaps read the role card more and the conversation broke down. So with some more practice, making use of all the OET resources about completing the speaking test, Jane Pearl will then feel more confident about getting ready for her speaking test soon. We're coming towards the end of the session, but I have a few key points from 3 other candidates that I want to discuss more briefly to give you some final tips for things to do and to avoid. So the first tip that I want to focus on is on signposting. This might sound like a little bit of a strange term, but what signposting means is letting the patient know when you are changing direction, so that they know that you're about to start a new topic. And if you've ever been a passenger in a car or on public transport and the driver suddenly turns left or turns right when you weren't expecting it, you know that that's really disorientating and worrying. And the same is true when you're listening to someone speaking. If they suddenly change topic without any warning, it can make you feel a little bit anxious. So I want you to listen to these 2 extracts and then tell me if they are good examples or poor examples of signposting.
I need to ask you a few questions. After your surgery, did you have any pain, or have you noticed if any discharge, I mean, any pus came out from your wound?
I would like to highlight the importance of monitoring your skin. It's very, very important that you look after your skin properly and you check all the time about other signs and symptoms similar with this.
All right. There they were quite short. Do you think they showed good examples of signposting or poor, weak examples of signposting? Jijo suggests poor and Amir agrees. Well, let's have a look at the script. This is perhaps something a little bit new for some of you. So let's have a look at what they are saying. So what we can see on the script is both of the nurses use phrases to tell the patient that they are changing topic to a new line of questioning, or that they're going to cover some information that the patient needs to pay close attention to. So I need to ask you a few questions is a way of telling the patient what's about to happen. And I'd like to highlight the importance of is telling the patient that the next information coming is something that they really need to listen closely to. Both good examples of signposting. And signposting is actually quite easy to build into your speech with phrases such as, now I'd like to talk to you about, or what I'd like to explain next is. And you can also say, remember to do this, or it's really important that you don't. Those are all examples of signposting language that help the patient understand what's coming next in the conversation. The next point to focus on is your speed of speech, and it can be really easy for healthcare professionals who feel very familiar with the content they're discussing to speak quickly. And of course, knowing you only have 5 minutes to try and complete all of the tasks put pressures on some candidates to speak fast. But remember, as I said earlier, there's no impact on your score if you don't complete all of the tasks. It's the communication you are being assessed on. So I want you to listen to the speed of this candidate talking, and then tell me if you think it's appropriate for the patient or not. And you can tell me yes, no, or not sure.
Well, I do understand your concern about it. All you have to do now is just keep your sun. What I mean is just keep your skin get protected from the sun. As I've mentioned, like wearing any sunscreen or any protection, or you can wear some sleeves. So what you're gonna do in the future is just keep preventing any further exposure from the sun. And you had already undergone surgery before, and the cancer cell was already totally removed, and there's
All right, so do you think their speed was appropriate or not? You can say yes, no, or not sure. We've got a few yeses coming through, a couple of no's, and not sure. More yeses, I think, than no's. I think this speed of speech is okay. It is perhaps a little bit fast, nothing too extreme, but it is also a little bit repetitive and moves from talking about sun protection measures, then going back to the surgery without giving the patient any opportunity to contribute. And I think if the nurse had been going slightly more slowly, they could have built some of that in to what they were saying. Make sure you think about the speed of your speech and moderate it for the situation. So you need slower speech when you're giving out new or sensitive information, or perhaps when your patient is older. And you can use slightly faster speed when you're giving the patient information they're already familiar with, or when you're asking them questions. So think about speed and moderate it for different parts of the role play. The next little focus is on empathy, and this is something we talk to OET candidates about quite a lot, the need to show empathy for the patient's situation and or their health concerns. And again, I'm going to play you two candidates talking, the two extracts of the same candidate talking. And I want you to tell me which time the candidate uses better empathy. Is it in the first extract or the second extract?
Yeah, I just feel like it's another name for cancer. Squamous. It's. I'm just worried that it is cancer.
Actually, this type of carcinoma, it is a type of cancer. It is a type of skin cancer, but usually is not a type of cancer that can spread around your skin or around another part of your body, and usually it occurs after the long exposure to the sun. I think what you are doing now is the right thing to protect your skin with sunscreen and to wear hat during the hot periods of time. If you'll continue to do that, it's unlikely that you'll have another skin problem. And how your surgery went? How did you recover after the surgery?
All right. So which one did you think was more empathetic, one or two? We've got extract 2 coming through from Jane Francis, from Siru, from Netta. Yeah, I would agree with you. I think the second extract showed better empathy. And we can see this on the script. The second extract, the nurse encourages the patient that she is doing the right thing and that if she continues, the cancer is unlikely to return. Whereas in the first extract, the nurse does answers the patient's concern, but without any empathy. She could have added, for example, yes, of course, it's natural to feel worried. And the empathy in extract 2, I'd like to point out, would be even more noticeable if the candidate worked on their tone of voice, which we've talked about earlier in the session, making the tone sound warmer to match the words that she is using. So the tip with empathy is don't be too quick to get into your explanation, like in extract 1. Demonstrate active listening by using some empathy first. So the last focus area I want to pick up on is being patient-centered, and healthcare regulators and employers really value nurses who can demonstrate patient-centered care. And this means involving the patient in planning their treatment pathways, asking for their contributions when taking a history, or understanding their current health situation. And for some OET candidates, being patient-centered is a new approach, but we do have lots of resources available on the OET website to help you pick up the skills that are required. So this time, again, you're going to listen to 2 extracts, this time from different nurses. And this time I want you to tell me whether they are demonstrating patient-centered care or not. Okay, which one is better or worse for patient-centered care?
Yeah, I understand more now. So am I likely to need more surgery in the future? Maybe more lesions will appear?
And no, as I told you, there is nothing to be worried about. After the lesion is removed, the cancer is unlikely to spread and no need for anything else. But the most important thing is you need to monitor your skin for changing spots, or you need to have regular checkup with your doctor. Is that manageable for you?
Yes, that's what I believe needs to happen. The doctor told me I had to come for this today. Yes, it's some kind of squamous cell carcinoma, he said. But to be honest, I think that was just really another name for some kind of cancer. So obviously I'm quite worried about it.
Okay, I could see that you're a bit worried about this, and you felt like it's some kind of a very severe condition. But I just want to assure you that this type of cancer is skin cancer. The medical term squamous cell carcinoma is related to a skin cancer, and which is caused by a overexposure to a sun or ultraviolet radiation. And the surgery you have underwent went successfully, and there would be it would less likely to reoccur in the future because the surgery was very successful, and there is no any possibility of spreading of this type of cancer. And
I see. Okay.
yeah.
All right, so what did you think? Were these nurses showing patient-centered responses? We've got quite a few people saying yes, they were patient-centered. We've got a couple of responses as well suggesting the first one was patient-centered, somebody, the others saying the second. So let's have a look at the scripts for these two nurses. In fact, the first nurse is not very patient-centered. As I told you, sounds quite impatient, and there's nothing to be worried about. Also dismisses the patient's concerns and is likely to make them feel they're not being listened to properly. In comparison, the second nurse's response is better. He does acknowledge the patient's concerns and echoes what they are worried about. For example, that's a severe condition, before providing some reassurance. So like empathy, being patient-centered means including the patient's concerns and exploring them so they feel more comfortable or at least informed. And you can do this by showing active listening, summarizing what you have understood of what they said, and asking them to confirm this, as well as asking further questions to understand more. So we've now looked at 7 samples of nurses completing the same role card and some strengths and weaknesses across all of them. But common weaknesses across all of the samples, and actually for all OET professions in general, is accurate questioning techniques. And a successful healthcare consultation has a typical structure of starting with open questions and then moving into closed questions. And most role cards will include at least one task which will get you to demonstrate questioning. So it is really important that you work on this. And we're going to finish off the session by looking at some examples of successful and unsuccessful questions for this role play. So first of all, thinking about open questions, let's see if we can match the questions to the correct column. So perhaps let me know which of those questions you think are the unsuccessful ones. Which ones don't work as open questions? Sorry, which ones are unsuccessful? Here we are. I'm going to show you the answers. See if you found these the same yourself. So do you have any concerns about that? Is actually a closed question. So somebody asking that at the start of the role play isn't in fact asking an open question. And why did you come today is actually a little bit of an abrupt and rude option for an open question. So how are you doing so far? Do you have any concerns that you want me to know are much more successful? And here are some examples of successful closed questions asked by our candidates. There are still a few corrections that are needed to make them accurate as well as successful. And that's certainly something you should pay attention to. It's good to get open and closed questions right, but also try to make sure your questions are accurate grammatically. In information gathering, one of the assessment criteria you're assessed on, one of the descriptors is to avoid compound or leading questions. And I have one example of each here. Excuse me. Option 1 is a compound question. And compound question asks the patient more than one question at a time, which is quite confusing for the patient to know where to start with their answer. Option 2 is a leading question, and leading questions should be avoided because they put ideas into the patient's mind that they perhaps wouldn't have thought of otherwise. So we can improve those two questions. We can make them successful questions. As you can see, the first question could be changed to how was the wound after your surgery? So instead of naming all the different options in that compound question, ask the patient to describe the wound after surgery in their own words. And instead of that leading question, we can change it to, sorry, there we go, do you wear sunscreen? So instead of the you wear it right, which is a leading question, change it to a more normal phrase, which is do you wear sunscreen? So that brings us to the end of this session. And if you are a nurse watching, I'd love you to let me know in the chat whether you learned something useful from today's session. So if there was something particular that you found really helpful, let me know in the chat what that was. And it helps us to know whether there's more content that we can deliver for you on the same topic. Now, I don't think there's particularly been any questions coming through during the session, so we will finish the session here now. But I want to let you know that the roll cards will be added to the OET website early next week. But in the meantime, we're also adding a link to the assessment criteria the assessors use to score your speaking, which I mentioned earlier in the session. If you haven't already bookmarked this page or downloaded or printed it off, I really recommend that you do that. And then next time when you're practicing, or perhaps when you are practicing with this card in particular, you can use these assessment criteria to listen to the recording of yourself doing this role play, and then reflecting on your strengths and weaknesses against the criteria that the assessors are using for speaking. Thank you so much for joining me today. I'm glad to see all of the comments coming through about what you found useful, and we'll see you again very soon. Bye for now.